I can ask a question about New York today was the latest to work on their mask mandates. Several states are now, it seems, well ahead of the federal government in explaining the path out of the pandemic. Is the president now falling behind states in explaining to Americans how or we all can sort of resume our normal lives and get back to normalcy?
Well, the president has been clear and has said that we are moving toward a time when COVID won't disrupt our daily lives, a time when COVID won't be a constant crisis. I think you all heard him talk about that in his press conference 2 weeks ago. And that is something that, as Jeff Zients, I believe, just said during the COVID briefing earlier today, there's an active and ongoing work plan to develop a path forward. And that is, there's constant discussion about that. I think what you're referring to as it relates to New York, which is an important component, especially as Americans are consuming what it means and where we're going, of masks and what the mask guidance is. Dr. Walensky was also on this COVID briefing that happened just earlier this morning, and what she conveyed on that briefing, I know there's a lot going on, she may not have all seen what she said, but is that we certainly understand the need to be flexible. We want to ensure that public health guidance we're providing meets the moment we're in. We recognize people are tired of the pandemic. They're tired of wearing masks. I bet all of you are. I certainly know I am. We all understand that, but that what our focus is on is looking at the data and the science. So there are positive signs, as she referred to. Cases and hospitalizations are falling. We're looking at all of the guidance based on the latest data and science. She also said, which is I think important for people to note, that while we continue to recommend masking in areas of high and substantial transmission, which is basically the entire country at this point, that's essentially everywhere for indoor settings, we are evaluating rates of transmission. We're evaluating and looking at data to see if any changes need to be made. And that is something, of course, the CDC continues to do. So I would say that we are internally discussing, of course, what it looks like to be in the phase of the fight against the COVID pandemic, where it is not disrupting everyone's daily lives, where people are moving on and living, lives free of hopefully masks at some point, and many of the restrictions that we've all been living through over the past 2 years. But as the federal government, we have the responsibility to rely on data, on science, on the medical experts. That's something the president committed to during the campaign. They confirmed during this briefing, they're continuing to evaluate, and there's ongoing discussions and work happening internally.